Hi, good afternoon. My name's Dr. Tay. I have a lot of patients that ask me what actually happens when you come for your filler appointment. So today I've got Theodora with me, who's going to help me demonstrate a procedure on her lips. As women get older, the lips tends to get thinner, and it's a very popular treatment that a lot of women look for, to have their lips a bit pumped, looking a bit more hydrated, and to have a more defined shape. So what we're going to do today is to show you what actually happens during a procedure. So first of all, because the lips is a very sensitive area, there's lots of nerve fibers, so it can be quite painful during the injections. So what we'll do is we will put some numbing cream called Emla that numbs the lip area to prepare for the procedure. So a generous amount of cream will help to numb the skin around the lips nicely to minimize the pain during procedure. So some people are prone to cold sores around the mouth area, so any procedure around the mouth can sometimes trigger off a flare-up. In those cases, we would recommend having a course of antiviral after the procedure to prevent a flare-up. Right, so the numbing cream has been on for about 15 minutes and Theodora is feeling numb around the lips area, so we can start the procedure. So first what we do is we clean the area with a wet wipe, make sure the skin is nice and clean, wipe away all the numbing cream. Okay, and then next what we do is we use an alcohol wipe to again sterilize the skin. So try not to take any deep breaths. This will feel a bit cold. Okay. So the filler we use today contains some local anesthetic. So the first injection would be a bit uncomfortable, and then once the local anesthetic start to work, it shouldn't be as uncomfortable as the first few injections, okay? So we're going to start the procedure now. How does that feel? Good. All right. So that's the first injection done. How do you feel? Fine. Fine, that's good. So can I continue? Mm-hmm. So I'm just putting filler in the corners, in the border of the lip to give it a bit more definition. And you can see the lip swells up quite a lot comparing to the other side with 3 injections. It's already quite swollen. So when you come for your procedure, just make sure that you give yourself a few days of downtime, because the lips, as I said, can be quite swollen for the first 48 hours, and the swelling slowly goes down over the next 2 to 3 weeks. Okay, so that's the top lip. Now I'm going to go for the bottom lip, again around the borders. What I'm doing is I'm going to put some fillers in the border of the lip to give it more volume and definition. So we reassess after doing half the procedure. Okay, I've done half of the lip here. One side is a lot more swollen than the other side, and that's expected. And I've used half of the syringe of the filler. Okay. So now we're going to continue with the other side of the lip. Okay. So same. How's the pain?
Very little.
You've got very good pain threshold. So just let me know at any time if the pain's too much, and we can stop and have a bit of rest. Let me just feel for any lumps or bumps. We don't want any unevenness. It's not unusual to feel some lumps in the first week or 2 after treatment. That is part of the swelling process. It will eventually settle down. But we've put 1 ml of filler into Theodora's lip, and you can see there's quite a bit of swelling, but also the volume has enhanced. We will re-evaluate things in about a week's time when the swelling settled down for the results, and we will come back to you next week.
Thank you. That was very less pain than I thought.
Okay,
yeah,
good to know.
Very bearable. Yeah, very good.
Very bearable. Very good.
Yeah.
So we've returned 1 week after Theodora's treatment. Theodora had 1 mil of lip fillers a week ago. They were quite swollen initially right after the treatment, and they've settled in nicely now. You can see her top lip, there's much more volume and a better definition compared to before. Are you happy with your treatment, Theodora?
Happy. Thank you. They look very natural.
So if you're interested in looking for a filler treatment, the sort of clinic you would be doing research on, they should have very good positive Google reviews, giving you sort of customer satisfaction guarantees. Also look whether they're registered with the CQC, which is the Care Quality Commissioning Group. That will ensure that the clinic has good clinical standard with a good safety records and are being inspected regularly. I hope you find this information useful. If you're interested in finding out more, we'd love to hear from you.